Well, hello, everybody. Welcome and thank you for joining us for day one of the 2022 IWMF Education Forum. I am Sharon Rivet, and I live in beautiful upstate New York where I teach yoga. I am also a WM patient and on the IWMF Ed Forum Planning Committee, IWMF ambassador to the Lymphoma Research Foundation, and I participate on the Bayesian Patient Advocacy Council. So it is my pleasure today to introduce our next speaker, Dr. Mary Kwok, who is a clinical associate professor in hematology at the University of Washington and a clinician on the myeloma service at Seattle Cancer Care Alliance. Dr. Kwok completed her hematology oncology fellowship at Walter Reed National Military Center and served as staff hematologist oncologist at Walter Reed and as clinical collaborator with the NCI. Dr. Kwok sees many Waldenstrom's patients as very familiar with this rare disease, and she will now explain some of the challenges and benefits of getting a second opinion. So now I'd like to turn it over to Dr. Kwok.
Thank you so much, Sharon, for the kind introduction. And it's nice to be here with so many of you. I hope that you're having a great meeting. And just to clarify my slide, we're in the process of a name change from the Seattle Cancer Care Alliance to Fred Hutchinson Cancer Center. It's a pleasure to be able to talk to you today about a topic that is not necessarily unique to Waldenstrom's or patients that have a diagnosis of Waldenstrom's, but it's very common actually amongst patients with cancers in general. And so what we'll talk about today is about getting a second opinion and some of the challenges and some of the benefits in getting a second opinion. So I thought that maybe we could just start out by defining what is a second opinion. And essentially, a second opinion is an opportunity to reassess a diagnosis or treatment plan by a specialist. And essentially, this typically entails not only just a visit with with a specialist, but also entails a lot of things, including review of the biopsy results by the pathology department at that medical center, typically review of your imaging studies, review of your labs, and then, of course, reviewing the history. This might involve sharing your story again, which is probably something you've done many times by the time that you've seen the person in second opinion, and kind of coming up with their own conclusion based on the data that's gathered. Frequently, when patients are seen in a second opinion at a center that sees a lot of Waldenstrom, for instance, these cases are discussed in a multidisciplinary tumor board. And so what a tumor board is that it includes physicians, not only that see the clinic, see the diagnosis, such as the hematologist, oncologist, but also might include somebody from pathology or radiology or radiation oncology, or other specialties. Actually, patients are able to get second opinions for a variety of diagnoses, not just cancer. But oncology especially has a very high rate of second opinions, with a rate that's estimated at up to a third of patients that have a diagnosis of cancer seek second opinions. I think it's interesting, though, because we should remember that second opinions are distinct from other types of medical communication, right? So typically when patients seek a second opinion, there's some sort of motivation usually that comes to seek that second opinion. And we'll talk about that a little bit more. But also when patients have a second opinion, inherently it's triadic, meaning there are multiple people involved in this medical visit. There's you, the patient, there's the oncologist who's referring you, and then there's the consulting oncologist who's providing the consultation. And those are probably the three components that are there all the time. However, there might be additional complexity if there are family members that join in, either to support the patient or to add additional questions. And then sometimes there's more complexity because trust and loyalty may play a role. So perhaps there's a lot of loyalty to your referring oncologist, or maybe trust, or even the opposite, like lack of trust, which may add to the complexity. But at the end of the time, usually a second opinion typically concludes with going back to the referring oncologist with the recommendations from your second opinion visit. So the question is, why would you get a second opinion in the first place? Like, what are the benefits? And I think that in general, these are some of the principles. If you have a complex diagnosis, like it would be helpful to get a second opinion in this instance. If you're looking for expertise because your diagnosis is rare, sometimes it's simply to get more information about a diagnosis or treatment. And I think this is very common, especially if this is in the setting of a new diagnosis, because there's, first of all, a lot of information that might be coming in, sometimes even trickling in. And sometimes it's helpful to get somebody to be able to put it all together into like a coherent diagnosis or treatment plan. Sometimes I think this is a very commonplace time point where patients seek second opinions, when there's actually a treatment decision to be made. Patients sometimes find it very helpful to make sure that they've explored all the potential options so that the comfort level with the treatment decision is highest. Other times it's to explore clinical trial options, and clinical trials might be available at a variety of different places. And so to seek trial options is always an important thing to consider when you're seeking a second opinion. And sometimes it's really because you want the pathology to be reviewed at an institution that sees a lot of a certain diagnosis or a radiology review. And then sometimes, and this is probably more the exception than the rule, it's to transfer care, meaning you want to be treated at a place that has that sees your diagnosis more frequently. And so I thought that in light of those questions, what are the things that might come up for patients that have a new diagnosis or have an existing diagnosis of WM? And so to get at the first point, Waldenstrom macroglobulinemia is a rare diagnosis. The incidence is roughly about 3 per million people per year in the United States. So only about 1,400 new cases per year in the US. The other thing with Waldenstrom's, especially, that I see a variety of patients come in with a variety of different symptoms, is that the presentation of patients with WM really can vary from patient to patient. Meaning, some patients may have a diagnosis of asymptomatic Waldenstrom's and may be monitored for years without needing treatment. Conversely, some people or some patients may need treatment with their initial diagnosis, like if they're presenting with hyperviscosity syndrome. And then other times, WM can present with really unique manifestations, meaning maybe it's not presenting with those symptoms of hyperviscosity or cytopenia that we're typically looking for. But maybe we're seeing more uncommon manifestations, such as Bing-Neal syndrome or cryoglobulinemia or something like that. The other thing is that not everybody with Waldenstrom's is treated the same, right? So sometimes treatment decisions can vary based on whatever molecular markers are present in the patient. The other thing to consider would be if there are different side effects associated with the treatment. So not only physical side effects, but dosing frequency, cost of treatment, route of treatment, whether it's IV or oral. A lot of things can play into different decisions. I put up a scenario here for somebody that was newly diagnosed with WM. And the question is, what should you expect during a second opinion? So during that visit, we would be reviewing your symptoms and your medical history. So not just the diagnosis of, or whatever was surrounding the diagnosis of WM, but what other additional medical problems may exist that could go into the decision making or help us understand what kind of symptoms you're having. We would review your symptoms, review your history, and then, of course, confirm the diagnosis of WM. So, for instance, patients that have a diagnosis of a monoclonal M spike, so an IgM M spike, can have WM, but we have to keep our differential broad, thinking of other types of lymphomas or maybe even MGUS. But once that diagnosis of WM is made, that would require biopsy review, so bone marrow biopsy review or lymph node biopsy review. And this is typically done by pathologists who specialize in looking at these types of biopsies. Review of imaging, so review of maybe any CAT scans you've had or ultrasounds or PET scans or MRIs. And then review of labs. Sometimes this is not just a point in time that we're looking at, but we're looking at trends over time and things like that. Further characterization of the WM is pretty significant because we know that when patients are diagnosed with Waldenstrom, that not everybody needs treatment right away. So are we looking at a patient that has asymptomatic disease that can be monitored, and how frequently should they be monitored? Or if they're symptomatic, what are the symptoms? What are we looking at in the beginning? What will we be following during treatment and things like that? In addition, typically when you're seeing a site that sees patients with a lot of Waldenstroms, it might be helpful to see some of the other consultants that are available at that institution. For instance, we have neurologists that we work with pretty closely at our institution, or maybe even ophthalmologists if there are vision changes and things like that that are also pretty familiar with the diagnoses. The other thing to talk about is, of course, treatment, right? So that's probably the biggest reason that people might seek a second opinion, to get treatment recommendations and then also to explore clinical trials. So generally, when we think of cancer clinical trials, we think that clinical trials offer patients really an opportunity to be at the cutting edge of treatment. And then, of course, follow-up recommendations and things like that. The other thing that might be less clear is who requests second opinions in the first place, right? And the answer is that it can come up from a variety of different sources. So sometimes this second opinion is initiated by the patient, either because the patient has done their own research or there's a need for certainty in the diagnosis or treatment plan, or maybe a need for more personalized information, meaning not everyone with Waldenstrom's is the same, not everyone is treated the same. And so, the desire to seek a more personalized treatment plan or personalized information about your disease. However, sometimes a second opinion might be actually recommended by your treating oncologist, especially with a diagnosis that is rare, like Waldenstrom's. Maybe they have limited experience, maybe only like one patient with Waldenstrom's a year or two. And especially if there's an unusual presentation such as Bing-Neal syndrome, your treating oncologist might actually recommend or request a second opinion. The other thing might be really to explore clinical trials or treatment options that might not be available at home institutions. For instance, access to novel medications or novel ways to treat Waldenstrom's. And then lastly, sometimes this is requested by insurance companies, basically to confirm the treatment plan. I would say, in my experience, most of the time, the second opinion request is coming either from the patient or a treating oncologist. So then the next question is, when is a good time to get a second opinion? And probably the two most common times that I would see patients would be because they were just recently diagnosed with Waldenstrom's. And Waldenstrom's is a unique diagnosis in that it tends to be slow growing. So frequently there's actually time to get your second opinion. There's time to make the appointment, to get everything reviewed before any type of treatment is necessary. This might not be the case for everybody though. For instance, if you need treatment emergently, for instance, if there's hyperviscosity syndrome, then that might not be a good time to get the second opinion or to delay treatment because it can result in other consequences that might be detrimental to health overall. The other time people frequently seek a second opinion would be if there's a treatment decision to be made. So this can happen with the initial diagnosis of Waldenstrom's, but it could also happen when the Waldenstrom's relapses. And lastly, if there are any questions that come up. So, you've been presented with your treatment, maybe you're already on treatment, but there are questions that are coming up that, you just want additional answers to, would be another time to get a second opinion. The other time would be if your cancer is not responding to current treatment plans. So maybe to either just kind of take a step back and look at the bigger picture, or again, to seek treatment options that might not be available at your home institution. So for instance, an autologous stem cell transplant may not be available at your place. And so maybe that's where you go to explore options like this. So we talked a lot about the benefits of a second opinion, timing of the second opinion. So what are the challenges to getting a second opinion? And I think that the first one is probably the biggest thing that I hear about all the time, that it's sometimes difficult to get a timely second opinion. Sometimes patients might have to wait weeks for the referral, for the records to get sent over and reviewed, and then just to get the appointment itself can take weeks. Sometimes there's a need for travel, especially if the second opinion doesn't happen close to where you live. For instance, you might need to even go on a plane or take time off of work. That might be even longer if additional testing and things like that need to be done when you're getting the second opinion. One thing that I think comes up a lot as a potential concern is a fear of impacting your relationship with your primary oncologist. So maybe a concern that you might be offending your treating oncologist, or that you have to do this kind of on your own. I think that this is a really valid fear that I hear from a lot of patients, which I will address further. But just to kind of address it now, is that second opinions on oncology are very, very common, and that I would encourage you not to let this third concern be a huge challenge to getting a second opinion. There are always the concern for potential costs, especially if you have to travel outside of what's approved by your insurance or things like this, or whatever established relationships there are with your clinic's program. And then there's another question where patients get multiple second, so third or fourth opinions. At that point, one of the challenges becomes that the responsibility of your primary treatment becomes unclear. Like, who's in charge? Is it your primary oncologist? Is it the second opinion? Is it the third opinion? Is it the fourth opinion? Like, that becomes less clear the more people that are involved in your care. And the last challenge, and I think that this probably comes up, is if all these different opinions results in multiple treatment option recommendations. So I guess the first thing would say, so at this point, if you've made a decision that you want a second opinion, the next question would be, how do you ask for one? And I think it's really interesting that in the medical literature, there are actually papers that talk about this concern that patients might find it hard, not only in the medical literature, but also in patient advocacy, like websites and things like that. And so I guess it's important to acknowledge that some people might find it hard to tell their doctors that they'd like a second opinion. And what I would say to that is to remember it's common for patients to get a second opinion, and doctors are generally comfortable with this request. I like these examples that are put forward by the website cancer.org because they give you some basic questions to maybe have to start that conversation. So something like, I'm thinking of getting a second opinion. Can you recommend someone? So this is a way to work together with your treating oncologist in setting this up. Or to simply say, before we start treatment, I'd like to get a second opinion. Will you help me with that? Or if you had my type of cancer, who would you see for a second opinion? Or to say, I think that I'd like to talk with another doctor to be sure I have all my bases covered. These are very simple statements to get that conversation started. I think if I can say one thing that was really good that came out of the pandemic is that telehealth really became more accessible to a lot of people. And it really accelerated the routine use of telehealth. I'm sure many of you have experienced having a telehealth visit with your doctor as well. Many cancer centers offer and even advertise telehealth consultations. I've heard from patients that, like, once they were diagnosed with Waldenstrom, that all of a sudden their Instagram feed is like full of things associated with Waldenstrom. It's kind of funny how technology is able to do that. And telehealth may make second opinions more accessible to patients, especially when it's difficult to travel, either because of cost or time, or because of concerns about exposures or health and things like that. So I think those are definitely the upsides. However, the potential downsides might come if you're seeking a telehealth outside of your provider's typical established connections, because that might impact the routine communication that happens. Usually, local physicians are used to working with their closest referral center and have pretty good communications with that. I would say that that's been my experience in Seattle and working with the local oncology community. And so sometimes that might be a little bit less smooth if going outside of that network, but again, not a full barrier either. So if you'd like a second opinion, you've now asked your oncologist. Your oncologist might actually have a recommendation of who they might want to see, or who they would recommend that you see. And then your oncology practice can help send those things, including your clinical notes, your lab results, your imaging CDs, or pathology slides. They can be sent to the institution where you're having a second opinion in advance of the consult, so that by the time you're seen, all this is being reviewed. And they may also help with communication of recommendations. Typically, if someone's being referred to me for a second opinion, I'll reach back out to the referring oncologist, either through a call or letter or something like that, to communicate what my recommendations are. If your oncologist is not familiar with a Waldenstrom specialist, the IWMF actually has a directory of physicians all over who might be accessible to you. It might be a good idea to just ensure that your second opinion is covered by insurance, so that you're not, so that you're covered and not surprised by any financial burdens that might come with that if it's out of network or something. It would also be helpful to bring a friend or family member. Usually during these visits, you're given a lot of information about your diagnosis that you may or may not already know, treatment options, resources, clinical trial options. And it's always helpful at this point to have a second set of ears as you're gathering that information. And then lastly, what I would recommend is that you take notes or receive some sort of written type of material from that visit, so that you can reflect back on it or refer back on it whenever you return home. I really liked this resource that was from one of the papers that I had read about communication and second opinions. And so I thought that maybe I would share these tips. So some helpful tips for patients is to talk to your primary oncologist about the second opinion. But also, as you're having your second opinion, even having your first opinion, listen to all the different advice you're getting. But at the end of the day, all this information is to help you make your own decision. And so feel empowered that you can make your own decision. The other thing is to realize that the right for a second opinion doesn't necessarily mean that you have to get it or that you even need a second opinion. So at the takeaway after this talk is certainly that, second opinions are beneficial, but may not always be necessary. It's always helpful to write down what you expect from the second opinion. When you're having a second opinion, it may not necessarily mean you're seeing that specialist in the long term. And so it's really helpful to know, like, why are you doing this and what do you hope to get out of it? So that at the end of the visit, those expectations have been met. Take notes. And if there are questions, this is your opportunity to ask for clarification. Sometimes after a second opinion, one thing that might come up is maybe additional information is needed or maybe additional tests are needed. In the event that your negative relationship with your primary oncologist has prompted the second opinion, it's okay to discuss it, but I'd encourage you during your visit to really focus on the needs for the future. Right? So really take advantage of that visit that you're having with your consultation, with your second opinion, to really address what's in the future rather than dwelling in the negative past events. If you're given multiple treatment options, this is a great opportunity for you to clarify risks and benefits of each of those treatment options so that you can ultimately arrive at the best decision. And then at the end of your visit, it's important to be explicit about what your expectations and preferences are about what will happen after the second opinion. Like, how will things be communicated? Is this a one-time visit or would you return? And to kind of, to state those so that we're all on the same page. So this brings us to the end of our slides for this discussion, but I'm really excited for the next part, which is the Q&A. And so I think Sharon will be coming back on to moderate that.
And really providing great advice from the healthcare professional perspective. We know that it's important to efficiently communicate with our healthcare team, but we also know that navigating medical records, protocols is sometimes confusing and frustrating. So thank you. Well, we have actually over 20 minutes for you to take some questions from the audience. So I will go into our questions and get started. All right. Our first question is, what does one have to do to get a second opinion from either Dana-Farber or the Mayo Clinic?
I think that's a great question. I personally have shared patients with the Dana-Farber and the Mayo Clinic. And I would say the first step is just to put in a referral. Especially more recently, both Dana-Farber and Mayo Clinic have provided telehealth consultations for patients of mine, although I'm not sure how the rules are state by state. And so those things probably need to be clarified. Like people like Dr. Castillo and Dr. Trion, Dr. Gertz are wonderful to work with. And so I only have like the best things to say about them. But I would say the first thing to start with is just placing the referral. And then probably the logistics of how it works out will vary person to person.
Great. Thank you. All right. Our next question is from a person in Houston, and they would like to know, where is the best place to get a second opinion?
That's a good question. I think the IWMF has a list of has a list of physicians, state by state, where patients can seek second opinions. And I think that's probably the resource that I would direct you toward. Sometimes your treating oncologist can provide a recommendation based on their own experiences as well. But I agree with the comment made earlier that probably the Mayo Clinic and the Dana-Farber are just two excellent institutions to look at as well.
And yes, you are correct. The directory can be accessed from the website.
Wonderful. Thank you.
All right. Our next question is, how do you overcome the roadblock of transfer care with the same insurance provider? So in this situation, it's an HMO. Often the prospect doctors do not want to accept you due to peer pressure.
I'm sorry that happened, first of all. Transferring care, I guess I would want to know, like, what are the barriers that came to that? And if it's really just like a personality type thing, or like not wanting to upset anybody, like, I think that most people probably wouldn't be too upset, if it was in the best interest of the patient. I think personally, like, that's how I would approach something like that. And everybody's different. Everybody kind of has a different comfort level. But at the same time, I know that there are things in place so that there's consistency, and to really try to facilitate the best relationship with your treating oncologist. So I'm not totally sure how to answer the question. I think that clear reasons, might be if, for instance, a clinical trial option was only available at a certain place, or a certain treatment option was only available at a certain place. Like that's more clear in my mind. If it's more like a peer pressure type thing, I'm not sure specifically how to navigate that, because it's probably different from office to office. Sometimes I would say that changing or transferring care will result in things that will be more difficult. Like, for instance, if you have to travel more, or maybe it might fracture your care if you're getting your oncology care at one place, but maybe your cardiology care somewhere else. Like, sometimes that makes it a little bit more tricky in terms of communication as well. I'm not sure that I answered the question there. Sharon, if you want to ask more refining questions, like, that might be helpful.
I think that's, yeah, it looks like it might be one of those situations where it is the same insurance company, and I think probably responded as best we could. Okay. All right. The next question is from a person who is asymptomatic, although they have an IgM in the 5,000s, an SV, which is 3.1, and their blood or their bone marrow biopsy showed less than 5% of WM cells. Their oncologist would still like to start treatment to avoid any negative symptoms, such as a stroke, eyesight loss, etc. This person just switched to this current oncologist because their previous one retired. So she's not sure, how do I bring up second opinion? She said she was already, the doctor was in touch with a WM expert at their facility. So any advice how to approach this situation?
Yeah, I would say the first thought that comes to mind is that sounds a little discordant. usually when there's like such a high IgM level in the 5,000s, which I agree definitely makes us concerned that treatment would come soon. There are typically more LPL cells or Waldenstrom cells in the bone marrow. So I guess that would be the first thing, just to kind of get some more information about the diagnostic testing and if anything more needs to happen first. I also think that because there's a little bit of discordance, this would be actually a really great time to just ask to be seen by a Waldenstrom's specialist. If they're already in touch with somebody, you can ask to be seen in person. I will say I've reviewed charts and things like that before, but it's totally different to have the person sitting in front of you so you can assess the symptoms for yourself rather than kind of, getting that from secondhand, right? But also maybe this might be an opportunity to repeat a biopsy or, repeat imaging just because there's a little bit of discordance here. The other thing would be to, if you're able to do your own research and come up with a name of somebody who you'd like to see, you can also propose that to your oncologist, like, oh, you attended the IWMF meeting, you would like to see this person that's, a specialist, then you can also propose that as well.
Okay. All right. Thank you, Dr. Kwok. So we have another question about how to get your local oncologist to collaborate with a WM expert, either at Dana-Farber or Mayo Clinic, again, without insulting the local oncologist.
I hope they wouldn't feel insulted by a second opinion. I honestly hope that they would not. Again, like getting a second opinion is a request that's made very, very commonly in oncology, and especially for rare diseases. So hopefully that's not a big barrier for you. In terms of the question is how to ask for one.
Yes.
In terms of how to ask for one, you could simply just ask for one. I think most insurance companies would approve a second opinion. And again, especially if you know where you want to go, that can make it a little bit more direct.
Okay. Thank you. Next question, which I think points us back to the directory, is this person lives in New Jersey. Where is the best place for a second opinion? So
yeah, I would use the directory, I think.
Okay.
And see what's closest.
All right. Just scrolling through here. All right, this is, in my experience, it is getting a second opinion approved by my HMO. It would be a big fight for me to go to Mayo or Farber, but easy to go to Hutch, all in the terms of insurance coverage. Any advice, recommendations there?
Is this also in the setting of telehealth? I guess that would be my first question, because that's really cut a lot of the barriers, when it comes to travel and things like that. I mean, if the second opinion is only approved for the Hutch, then I guess you can certainly be seen at our place. And then if additional, questions exist or things like that, then I think, we certainly work together with Dana-Farber and Mayo to make that happen.
Okay. And actually, another question is, are the physicians in Washington, your state, allowed to do telehealth with patients outside your state?
Oh, that's a rapidly evolving question. So during the pandemic, I think a lot of the rules regarding telehealth were relaxed, and telehealth was actually used very, very commonly and across state lines. Um, and then as the pandemic has, um, you know, as things are, people are more vaccinated, and a lot of these rules are coming back up again. Um, so for us, at least in Washington State, there are states where we can do telehealth pretty easily. For instance, like Hawaii, right? However, other states are now requiring licensure, and so our physicians are becoming licensed in different states in order to continue to provide telehealth to the patients that we've been treating during the pandemic. So it really varies state by state.
Okay. This one, Dr. Kwok, I know you talked somewhat about it, but for a patient that's on watch and wait with no indication of treatment needed anytime soon, is there a reason to establish a relationship with one of the second opinion clinics so when the time comes for treatment, it's already been reviewed? Or since there's no current need, is it better to wait until things get started?
I think this is a great question because I've observed patients kind of like are on all parts of the spectrum when it comes to a disease that can be monitored. So for some people, it's a great thing, right? Like where, there's no need for chemo, you just need to get labs periodically, and, there's not a lot of questions that arise. And then for some people, like, it's really, really hard to have a diagnosis that doesn't need treatment, that's being observed, and leads to a lot of additional questions like, basically like what can be done to, keep it in remission long, or keep it off treatment longer, or, maybe there are additional questions in terms of, when would we expect it to progress, or, things like this. And so I think that for patients that do not require treatment, if there are questions that arise, or you're just somebody that likes a lot more information, or wants to understand the things more, especially if the diagnosis is new to you, then I think that this is a great time to get a second opinion. And I think it's an opportunity to learn. However, I would say probably the more impactful time to get the second opinion would be when there's a treatment decision that has to be made.
Okay. And this next question is, I think, a good segue. Are there any questions that you would recommend that people ask when they're talking with the second opinion doctor?
So I think that one thing that I've noticed when I provide second opinions is that patients learn a lot about their diagnosis from their own research, and sometimes may have not received a lot of that information from their own oncologist, or maybe received it, but it kind of got lost in the huge flood of information that was being provided early on. And so I think that one thing that patients can ask for during their second opinion visit would be to really get clarification and some, more characterization of what their diagnosis is. So for instance, if somebody has a diagnosis of Waldenstrom's, right, the big question would be to understand, is it asymptomatic? Is it symptomatic? Do you have a MIDI88 mutation? Do you have a CXCR4 mutation? Was it checked, or, was it checked or was it not checked, or did they try to check it and they couldn't get the results? When should you have your next, biopsy, or when should you have your next labs? Where in the body is it affected? So, is it mainly the bone marrow, or is it in the lymph nodes and spleen? Getting more characterization like that. Are there any signs of Macroglobulinemia or cold agglutinin disease, or, any of these more unusual things, like has it resulted in iron deficiency? kind of unusual things that might be coming up in Waldenstrom's, like those are the things that you want to get better characterized during your second opinion visit.
Okay, thank you. Let's see. The next question is my oncologist prefers BTK drugs as the first line therapy, and her reason is that there are less side effects than chemo. I have been reading that chemo remains the recommended first line at this time. Do you agree, or would a second clarify or confuse the issue?
This is a really good question because it comes up all the time. And my guess is that this is the kind of question where you ask two different oncologists. It's possible that you might receive two different answers. Even within the centers that we just talked about, like my guess is that I can guess what the answer is going to be at center number 1 and what the answer is going to be from center number 2. So it's really, it's possible that you'll get different recommendations, just like you've experienced already. At the end of the day, I think what you might benefit from is hearing the pros and cons of, say, BTK inhibition, hearing the pros and cons of chemotherapy, and then at the end of the day, arriving at your own decision, right? Because I think both answers are justifiable. And there are big differences in the way that these drugs are delivered. There are big differences in the potential toxicities or side effects. And then, of course, the patient themselves might be really different. For instance, for older, maybe more frail patients, we might lean more toward BTK inhibitors. But then if somebody's very young, we might think about the long-term side effects of chemotherapy. So there's a lot of factors that come into this. So I guess what I would say is it's going to be common for you to hear different recommendations, but what I would encourage you to do is to really hear what are the pros and cons of both. And at the end of the day, make a decision that's, best for you.
Great. Thank you. All right, we have a question that is asking whether insurance companies like Medicaid, for instance, will continue to pay for two doctors, the primary and the second opinion expert, who would help guide treatment over time.
Oh, yeah, that's a really good question. I'm not sure about this answer and specifically about Medicaid. I will say that just from my own personal experience, providing as a consultant, I'm usually not seeing patients in consultation like monthly, like your treating oncologist might be doing. However, might be seeing patients every 6 months or once a year or something like that to provide periodic input, or at the point where a treatment decision has been made. So I would say that's the more common scenario. Regarding payment, though, and specifically Medicaid, I'm not sure. I think we would have to check with the insurance company at that
time. Okay. We have another question, Dr. Kwok, about telemed. This person has been trying to obtain all their medical reports, biopsy slides, and unable to travel due to some chronic health issues. So the question of telemed again.
So most of the time when patients are referred for a second opinion, that center will request the slides and notes and things like that. So hopefully you're not having to do a lot of that work on your own. For instance, for patients that are referred to the Hutch, we have a whole intake team that works on getting that information. The big thing that we need from the patient is permission to access their medical records or to request those things. And so that's probably the big thing that you need to do. But once the referral is in and approved, like getting that information, we typically collect all that. And I would guess most medical centers do the same.
All right, thank you. Dr. Kwok, before we started this session, you and I were talking about some questions, and one of the things we talked about is once you've had that first visit with the second opinion doctor or the WM expert, what is the usual process after that?
So I'll tell you typically what would happen for me. So by the time that we've had our visit, at that point, typically we've reviewed your pathology. We've had a visit where I've heard your story, right? Would be all put together in a note, right? Like a clinical note or progress note that would go into your medical record. Typically, this medical record is shared with the referring oncologist, as long as the patient's given us permission to do that, along with our recommendations for what comes next, like, continue monitoring, or we would recommend starting treatment with something. Frequently, and it's a little bit easier if I have that person's contact information, like it will end with a call or some sort of messaging back to them. If I don't have their direct contact information, sometimes it just ends up being a letter that's sent to the medical office. The downside of which is the delay of like snail mail, right? Or faxing or something that has to happen manually. When I've sent patients for second opinions, for instance, I've worked with, the Dana-Farber and Mayo, like I mentioned earlier. Frequently, it ends up in another quick communication with short recommendations back and forth, or a quick discussion of the patient, and more detailed information that comes in the form of a letter. So my guess is that they do something similar to what I do.
Okay, thank you.
Yeah.
We have a couple of questions or comments about people who are concerned about offending their local oncologist, or they've actually gone for a second opinion and there was some tension when they got back. Do you have any words of wisdom that could help everyone with how to establish this relationship?
Yeah. Well, I'm not sure if my words are for everybody, but I think at the end of the day, when somebody asks for second opinion, my guess is it's not because they dislike their primary oncologist, and you go back to your primary oncologist because that's the person that's going to be there for you, right? When you run into trouble or when you need treatment, they're going to be the people that are walking alongside you for the long term. At the same time, my guess is that your treating oncologist wants you to make a decision that you're comfortable with. And again, I think that when they know that you trust them, but that also that you value your own health and wanting to make decisions for yourself, my guess is that your treating oncologist is going to be respectful of that. I think that, when you ask for the second opinion, when you ask for your oncologist advice on who they would recommend for a second opinion, you're inviting them to stay a part of that, that triad that I was talking about earlier, right? So these are all ways, to make sure that your treating oncologist is involved. Also, just to make sure that, they're also communicating with wherever you're going for your second opinion is also important, right? So because you want to make sure that those recommendations are made, but also that they're considered, that it's not just something that happened way over there, but something that will impact your care now. And so what I would invite you to do is, if you've had that second opinion, take the opportunity to discuss the pros and cons of what you heard during that opinion with your treating oncologist, so that they stay a part of your important treatment team, and stay a part of your decision making.
All right. Well, Dr. Kwok, it looks like we're coming up on time shortly. And any other advice you'd like to give?
I wish, we could all be together. I wish I could hear the stories of the patients that have had second opinions, both positive experiences and negative opinions. Like I realized as I was positive experiences and negative experiences. I realize as I'm putting this talk together that I'm coming at it somewhat one-sided, with my own experiences or maybe even drawing from the literature that's in the medical literature. But I think that this is a place where we could all like learn from each other too, like to hear like what worked for you, what didn't go so well, what could we be doing better as the consulting physicians. And so I would say I hope that one day we can, have a cup of coffee or sit in a room and talk about that. But otherwise, like I think the fact that you're even in this session is encouraging to me because I think patients are doing their best to learn about their disease, to become, their own advocates, and I love that, and I would encourage you to continue that.
Well, thank you so much, Dr. Kwok. We really appreciate you spending your time with us and sharing with us today. I think this is an important topic, and hopefully it has helped many of us out there.
Thank you so much.
All right. Well, on behalf of the IWMF, I would like to extend thanks and appreciation to this year's EdForm title sponsor, Beijing, our contributing sponsors, Pharmacyclics Janssen, Selectar, the Treadway Foundation, and X4 Pharmaceuticals. I'd like to thank everyone for joining today's EdForm. And just a few reminders that there will be a survey that'll pop up at the end. So if you could take a moment and answer the survey. And if you're going to view our next session with Dr. Castillo, just a reminder to please close out this current window and navigate to the theater tab at the top of your screen, then select the live now button and you'll see that it's in red. Well, thank you very much, everyone, and hope to see you at the next session with Dr. Castillo.